Hello, you're joining us on our Facebook Live with me, Surat Suresh. Well, today I'll be speaking about one of the main factors which is surrounding the number of tests that we are conducting. Yes, India has increased its testing capacity as well to over 240%, and the number of cases which are being detected as well has increased. Well, all of these being the factors, one of the important factors that we have to look at is whether or not India will actually surpass the mark that we are seeing. Probably in the projections which we are seeing is that by September, probably India will surge to the number one position as well with respect to the COVID-19 cases, because US over the past 1 week, the number of cases has reduced and their testing capacity also has increased. Yes, we are speaking about the testing capacity here because more the number of tests that we are conducting, probably more number of cases will be reported as well. But even though Trump recently said that US is testing the highest and India stands second, what we will have to look at is the per population or per million population is what we have to look at. And probably India, with respect to that, stands somewhere in somewhere on the 10th or the 11th position. Yes, we have got the figures here. First of all, it is going to be US which stands first. UK stands here with almost 15.2 times the number of tests per million that is being done compared to India, and probably after that is Russia, and then US comes into position. Now, speaking about all of this, let's understand where India stands with respect to per million. It is 20,000 tests per million that India conducts on a daily basis. If this is the condition, probably we will not be reporting the right number of cases. Probably the number of tests being conducted is not enough to the population that we have of over 136 crore. Yes. Now, to speak about this, we have with us the ICMR appointed epidemiologist as well as the surveillance research group member, that is Dr. Giridhar Babu, joining us over the phone line. Many thanks for joining us, Doctor. Firstly, if you have to ask, is India testing enough? Because the numbers show that probably per million population we are not testing enough, and probably that is why the numbers are not shown on the table as well.
Yeah, so good afternoon, Suresh. Thanks for having me. Now, India, as you said, increased the testing capacity over the last few months, and whatever we are doing now, definitely there is a scope to increase it further.
Correct.
If you look at United States, they are testing around 177,000 tests per million population.
Correct.
Brazil does around 61,000 per million population. And among the top four countries, Russia does nearly 194,000 per million population. So there is definitely a scope to increase at least by 10 times what we are testing. And this has to happen especially in those areas where surge in cases is happening now and is yet to happen. So sometimes what is happening is after the surge in cases, we are increasing in testing, but it's actually not detecting the outbreak. So the real use of test is to detect where the outbreak is present and then prevent as many deaths as possible. Correct. So now in the southern cities we are seeing the surge, as we are seeing in the metros, the district headquarters, tier 2, tier 3 cities and large villages which are having high population density. These are the places where we are seeing surge in cases, and that's where we need to be doing more tests.
Probably yesterday you had shared one image regarding the bubbles where we are seeing a small bubble or a large bubble on your Twitter handle, if I'm not wrong. You had spoken about the increase in number of cases in those small bubbles or the big bubbles where the government needs to focus on.
Yeah, so the point of showing the bubble was to identify those areas where the bubble was not present.
Correct.
If you have a smaller bubble, that means our testing capacity and the detection of cases will have to be enhanced. Whereas if there is no bubble at all in that area, that means that we are probably missing the transmission which is going on. So therefore, we need to be extra vigilant in scaling up the test. But simply testing is not enough, because sometimes what happens is you want to increase the test as an indicator. You can test people randomly also. So you'll have to
Correct.
identify those who are at risk, especially ILI, influenza-like illness
And
symptoms,
sorry cases.
and then and SARI cases and test them. SARI anyway they'll come to the hospital,
Correct.
but ILI sometimes they don't come to the hospital. So therefore, population-wide surveys are very important in identifying these people.
Now, Doctor, one important factor is probably this should have been done a little earlier. Like, yes, we have ramped up our testing process. Rapid antigen and antibody kits have been brought in and they have been procured and distributed to states as well. But probably this was supposed to be done much earlier in the phases, and now probably we should procure more. So, are we falling short in procuring these testing kits as well? Because that will become another hindrance in most of the states. Even if they can identify the people, probably they do not have enough testing kits to test these people.
No, I think there are plans, at least from whatever I am engaging in terms of the government responses. Several state governments are scaling up procurement, and they're also doing in batches. So as one batch is over, they're trying to get another batch in place, and there is continuous procurement happening. At the same time, since we are talking about testing per se, there are also limitations of rapid antigen tests.
Correct.
So especially symptomatic are tested negative, then you'll have to do RT-PCR.
RT-PCR.
Therefore, you'll have to scale it up, for both tests. Unlike Chennai, which is only doing RT-PCR.
Probably, Doctor, don't you think only RT-PCR should be taken up, considering that, probably it gives the right number always. Don't you think we should consider RT-PCR?
No, even RT-PCR is not, although we call it as gold standard, it is not cast in gold.
Okay.
70% is the sensitivity. That means even if RT-PCR will be missing around 30% of the people who might be having the infection. So there are limitations with these tests, but how we use these tests is very important. So when you test a symptomatic person and they are found positive, then we are okay, even with rapid antigen test. Only when they are negative, then we'll have to do with RT-PCR. That is the limitation of the test, and this is what the ICMR protocol says. And we need to recognize this and use it as such, and then there will be no problem.
Well, this reminds me of one study which the Harvard had done, where they had said that probably crappy tests, like they call the rapid antigen or antibody tests, they have called them crappy tests, and they've said if at all crappy test gives us at least some data, if we can do it on a large scale, probably we can identify more people at the earliest. Probably that should be incorporated or being taken up by most of the states and countries so that they can identify these people to the maximum.
No, in public health, we'll always have to look at the utility of any tool that we use, including the test. So, RT-PCR generally, the problem with RT-PCR is that it takes at least 2 days to get results.
Correct.
And you know how difficult it is in the urban settings to do RT-PCR on a scale. So therefore, when you do rapid antigen test, as you rightly said, we will be identifying most people who are positive. And if they have a symptomatic and then tested negative, then anyway we have the plan to do RT-PCR. Now the government of Karnataka has come up with a plan where the swabs are taken for both rapid antigen and RT-PCR. So even if they are not able to trace the people afterwards, they can send the swab for RT-PCR as soon as rapid antigen is negative in symptomatic. So by that, they're actually cutting down the amount of time taken to trace and test again.
Well, lastly, before I let you go, Doctor, now can we see a surge in the number of cases? Probably India, with the number of tests that we are conducting, can we reach the #1 spot by September?
I mean, that's not a medal of honor.
No, it's not a medal of honor, obviously.
No, so but even then, I think it is inevitable, just because of the sheer number of people we have in this country. But if you look at the population in terms of cases per million or tests per million or even deaths per million, I think even among the top 4 countries, we have by far the lowest mortality, deaths per million.
Correct.
And therefore, even if there is going to be an increase, and there will be an inevitable surge in cases, especially in those areas where they have not yet seen the surge, and all the tier 2, tier 3 cities and large villages with high population density, we will see the surge. So we need to be doubly careful in how to strengthen our health system resources in district headquarters, taluk headquarters, and use appropriate tests everywhere so that we detect early and save lives as early as possible.
Absolutely, Doctor. Many thanks for joining us, especially Dr. Giridhar Babu, who is part of the ICMR research and surveillance team. Well, probably he has gone forward. He is trying to understand. They have been discussing with the number of cases, with the number of tests being done, what kind of tests will actually be of some use or help for the people as well. How can we identify? Because one important factor, if you can actually go ahead and look at the Twitter handle and the picture which he's put out, the bubbles, what we are speaking about was which are the areas which are not identifying, or there are small bubbles there. That is the magnitude of testing is not happening there, or identification process as well. But in few other areas, the bubble is bigger. That shows that they are testing more. They have expanded their reach as well, and more people are being identified because of the rapid tests which are being taken up. So probably, yes, most of the states will have to now start procuring these rapid antigen kits, at the most or in large quantities, just to ensure that they can identify people at the earliest. ILI, influenza-like illness, is one of the most important factors which most of the states need to focus on now, because SARI cases they will be reporting, but ILI they will not come to the hospital itself. So that will become a problem. So there are possibilities. We have seen over with the number of cases that we are being reported in India, the maximum is with respect to ILI or the SARI cases as well. So yes, they are important. They have to be identified at the earliest as well. Well, the experts have said it is inevitable that we will reach the #1 position, not a guard of honor or a medal that we are getting, will be getting. But at the same time, what we will have to look at is what kind of tests we are going to be doing, how we are going to be ramping up the per million population tests as well. That number needs to increase, even though we stand second with respect to the number of tests which are done, but comparing it to our population, probably it's not enough. And in the coming days, probably ICMR will be instructing the states also to procure more of these testing kits and go forward and test more people. Probably, yes, it is important now that the states realize this. That's all we have in this particular Facebook Live. Many thanks for joining us. We'll catch you next time.